manner, which are the basic qualities of a systematic review and meta-analysis. So,
Waqas, can I just make a comment about the Bangladesh issue?
yeah.
As far as I understand, we have not made a final determination of whether we are going to do randomized controlled trials or observational studies, because at this point we don't know what exists out there, and I'm sure that is true for all the groups. So before we actually do the search, we have no idea whether there are enough studies of randomized controlled trials. Usually those are fewer and far between. They tend to be many more studies of observational trials. So I think in a sense, we should try to look at an approach which starts up with seeing what we have, rather than can't decide beforehand whether it's going to be observational trials or randomized control, because my experience is that there are relatively fewer randomized control trials relative to observational studies.
So it would entirely depend on your research question. Because if your focus is on finding out effectiveness of particular psychological therapies, then you're going to choose randomized controlled trials. And if your research question is going to be on prevalence of mental health issues, then you have to go for observational studies, right? So I think by the end of this session, you will have some idea that what kind of research question you are going to pursue later on.
What happens if you don't find enough studies? Suppose you're interested in randomized controlled trials, but you just don't find enough studies in there.
So what happens is, if you are doing a systematic review on effectiveness for particular psychological therapy, let's take it as an example, and so you have two choices here. Either you can limit your criteria to randomized controlled trials and cluster randomized controlled trials. So randomized controlled trials would give you a very good quality evidence, right? But if you don't find those randomized controlled trials, and you still want to look for this particular psychological therapy, then you might, add in an inclusion criteria that you would also be looking for open label trials or pilot studies or feasibility studies if they answer the question of effectiveness. But the problem here is that organizations like World Health Organization and Cochrane, they have developed a new technique called the GRADE. So what GRADE does is, if you want to make some sort of policy recommendation based on your systematic review, if your systematic review is based on randomized controlled trials, then they rate the evidence as excellent, good quality evidence or good certainty of evidence. And that, if those randomized controlled trials have little heterogeneity, have very low risk of bias, then your systematic review recommendation is just to be of very good quality, of excellent quality. But if your systematic reviews includes these quasi-experimental studies or pre-post studies or open label trials, then without even going further, your systematic review evidence is going to downgrade. Are you following me? So they grade your recommendation or your evidence into strong evidence, moderate evidence, low quality evidence, very low quality evidence. So just by inclusion of open label or quasi experimental pre-post studies, your evidence automatically gets downgraded. So even if I would recommend that even if you find out only 2 or 3 trials, it is worth going for systematic reviews that only look at those randomized controlled trials. And yesterday I had also mentioned that I have come across a lot of systematic reviews. One of the systematic reviews was on screening program for postpartum depression and anxiety, and they did not even find one study that answered their research question, and they still published it. So in the results section, they noted that no randomized controlled trials have been published on this topic, but they gave an introduction section and they had a generic discussion section. And then last year, we in one of the GDG meetings in the World Health Organization, one of the teams was working on mental health promotion programs in schools, and they spent around 6 or 7 months developing that systematic review. And when they came forward with the report, they had only found one randomized controlled trial to include in their systematic review. But even based on that single randomized controlled trial, they were able to give a good certainty evidence, because that single randomized controlled trial had a very good sample size, ensuring a good statistical power. It did not pose problems related to heterogeneity. It had a very low risk of bias. So they were still able to put forward a recommendation just based on one randomized controlled trial. So I would recommend that if you're looking for effectiveness of particular psychological therapies or treatment programs, just try to include randomized controlled trials and cluster randomized controlled trials only. Don't go for quasi-experimental or pre-post studies. But when you are looking for prevalence, obviously you are only going to add cross-sectional studies or baseline data from large prospective cohorts. Coming back to the presentation, today's module would not really have a lot of statistical jargon. Everything is easy and explained in lay terms. But from on the fourth day, when we come on to the meta-analytical meta-analysis module, that would have a lot of statistical jargon, but we have tried to explain them in lay terms as well. So even those with a non-quantitative background can have a good grasp of those concepts. So today, for the first item on our agenda for today's module is selecting the databases, choosing your search terms, building a search strategy, running your search, reading titles and reading abstracts, in order to select the final set of articles that is going to feed into your evidence. So yesterday we began with the selection of a research question, and then selection of an appropriate review design. And from today onwards, we are going to work on selection of sources, databases, search terms, building of search strategies. So the overall process that is going to lead you to that evidence that answers your research question. Why do you need a good research question, and why do you need to format that research question into a PICO framework? So yesterday we talked a lot about PICO and SPIDER and PICOT and PICOS, these sorts of terms. But why are these terms important? So let me start with a scenario. For example, you're applying for a grant to support your research and use of psychological and psychosocial therapies in perinatal depression. And this research is a systematic review search, of course, based on a systematic review design. So the possible questions that may come into your mind would be, would either have a very broad spectrum or would either have a narrow spectrum. For example, a broad spectrum question would be formatted as, what is the effectiveness of psychosocial therapies in prevention and treatment of perinatal depression? Now, if you want to narrow it down, then it may be narrowed down to what is the effectiveness of CBT. So now you're focusing on just one of the psychological therapies in prevention and treatment of perinatal depression in low and middle income countries. So this is an example of a narrow research question. And I always recommend that for your systematic reviews and for your meta-analysis, I always recommend that go for a narrower research question. Now, why would I recommend that you go for a narrow research question? This is because when you're working on a broad set of research question, for in this instance, with the choice of several or all of the psychological and psychosocial therapies. What would happen here is when you search for your evidence, you have to include evidence on all of the psychological therapies here. It can be CBT, it can be IPT, it can be non-directive counseling. So you are trying to include all sorts of therapies in this research question. And the problem here would be, as is common in a lot of global mental health research, that your research question would pose a problem related to heterogeneity. So for instance, if you lump up all of those research therapies into one, what would happen is, in the end, you are going to make a recommendation that psychological and psychosocial therapies work when you are to prevent and treat perinatal depression. But what you would miss here is you would miss a separate recommendation for CBT, IPT, a separate recommendation for non-directive counseling. And you would also miss a lot of insights when you're trying to explain your literature review in a systematic manner. So I always recommend that you go for a narrow research question. And also, at this point, when you look at this graph, you will also note that the broader your question, the more the resources that you are going to require, the more the time is required. When you search for a broad question in databases, you are going to get lots and lots of articles. For instance, we did a systematic review for the WHO that had a very broad research question, like the previous one that I have mentioned. And we got 20,000 titles and abstracts from 10 different databases. And it took us around 7 to 8 months just to sift through those articles and come up with a set of just 20 randomized controlled trials that were fed into our systematic review. And if your research question is broad, then there is a huge chance that most of those titles and abstracts and reference records that you retrieve from databases, they are going to be irrelevant. And it would take you a lot of work hours and a lot of manpower just to sift through those records. On the other hand, if you have a narrow question, a narrow research question, such as that focusing on a single treatment program or a single disorder, then that would always lead you to directly relevant articles that are and few number of articles, and this step in your systematic review would not be very resource intensive. So I always recommend that go for a narrow research question. So once you have chosen your research question, as most of us had done it yesterday, now you have to focus on what kind of bibliographic records or what kind of resources can you choose from in order to get that set of articles set of studies that answer your research question. So you could go for online public bibliographic databases such as PubMed, which is available for free to the public. And in some instances, Cochrane's trial central trial registry, you can even go to that. They have it available for free for researchers based in low and middle income countries. Or you could also choose public databases such as Virtual Health Library, which is offered by the World Health Organization. Or you could go for commercial bibliographic databases. These are the bibliographic databases that require some sort of subscription, either from your university or from your company or as an individual. So these sorts of databases include Web of Science and Scopus. These databases are not available for free, and you need to have some sort of subscription with them. But they are also excellent databases. You could also choose specialized bibliographic databases. So a specialized bibliographic database would be, as an example, PsycInfo, which focuses on literature published in psychiatry and psychology only. Another good source is hand searching of reference lists. This hand searching can be done in two ways. Either you can go directly to the journals, choose a set of journals that best correspond to your research question. For example, I had a question on CBT, so I would go on to journals such as Behavior Research and Therapy, BMC Psychiatry, JAMA Psychiatry, Lancet Psychiatry, because they do publish a lot on these topics. The other method here would be that you already have a set of articles that answer pertaining to your research question, and you sift through its reference list, and you manually choose the studies from there. For instance, those reference, the bibliography sections of those research papers may have randomized controlled trials related to CBT or any therapy that you are researching on, and you can choose the studies from there. The other source would be Gray literature. So Gray literature in this instance, in terms of systematic reviews, mostly include dissertations or papers that have not been published, or trials conducted by pharmacological companies that have not been published. So what you can do here is you can go to your university dissertation repository and search for particular dissertations that answer your research question. You could also go for databases such as ProQuest dissertation and thesis. So these are the databases that have a consortium of universities that deposit their students' dissertation there, both master's level and as well as PhD level dissertations. And just like you search PubMed, you can search those databases and get those dissertations. Then I do not recommend going for web reports, but in a lot of instances, you would find that organizations such as the World Health Organization, they publish web reports that are summaries or blurbs of the large-scale work that they have been conducting. Maybe they would have a policy paper, maybe they would have a summary of systematic review or summaries of randomized controlled trials that answer your research question. So you can always sift through those web reports and get relevant references. Another approach is expert opinions. So you can always email professors who work on research similar to yours, and you can ask them if they have if they had any recent work that they have been conducting on this particular topic, and if they have some preliminary results, or if they have some data that they would like you to include in your systematic review. Or you could also ask them that you have this set of studies that that you have found from your systematic database search, and if they could point out any studies that you might have missed. So these are some of the ways, most of the ways that you can choose from in order to choose a set of studies that is going to feed into your systematic review. And most of the systematic reviews, or most of the projects that we work on, we always utilize multiple sources. So we choose from online public databases, commercial databases. We always do hand searching on manual searching, and we also look for Gray literature. So let us talk in detail about where to search and what kind of bibliographic databases are there. So for medicine, I would recommend going for PubMed. PubMed is from a medical perspective, even from a medical perspective, it is interdisciplinary, and it has a lot of a range of journals to choose from, thousands of journals registered in PubMed. And they have, and most of the impact factor psychiatry journals and psychology journals are registered in PubMed. So it is a very good resource. On the other hand, people always recommend going for Embase, but I do not really recommend Embase because that is more suitable for psychopharmacological studies. You have Cochrane Library. So Cochrane Library, what they do is they sift through PubMed and CINAHL and a lot of these databases, and they also have a lot of researchers working on sifting through these databases and selecting randomized controlled trials. So their Cochrane library would only include, when you search for particular search terms, they would only include randomized controlled trials. So you do not have to worry about observational studies there. Then we have PsycInfo. Then there are multidisciplinary databases such as Scopus and Web of Science. These two databases, they have millions of peer-reviewed publications registered in their databases, and these are of multidisciplinary nature. So, for instance, if some author has published a study in, let's say, he was working on music therapy, and he did not choose a psychiatry or psychology-based journal. Rather, they went for a social sciences-based journal or a journal specific to music therapy or arts. So these sorts of journals would not be listed in medical databases such as PsycInfo or PubMed. So you have a better chance of finding these studies in Scopus and Web of Science. Then there is a database called CINAHL, which is relevant to nursing and allied health. Then you have websites, World Health Organization, Canadian Medical Association, and World Health Organization here, they have two relevant databases, Global Health Library, and they also have Virtual Health Library. Both of these databases are available for free. And we talked about their literature. Yes.
Taking the example of PubMed, for instance, a lot of these, when you access PubMed, you can get the abstracts, but to get the full text, you need to have specialized access. So do we, through the collaboration, are we going to be able to get access to full text, or how is that going to work? That's my main question for all the databases, because you might be able to get abstracts, but how are you going to get the full text?
So we have some strategies to find full text if you don't have access to a university library, and we will come to that later on. I have a set of resources which you can utilize to get those research studies, full text. And I'll come to that later on. We have a slide on it. And for Gray literature, as we talked about, we have ProQuest dissertation and thesis database, which will give you access to full text of dissertations. We have Scopus that also has conference proceedings, posters. You would also find posters, conference proceedings, conference articles in Scopus and in Web of Science as well. And then you can always use Google to search for studies. So a lot of times, if I have missed some sort of study some studies in Google Scholar or through database academic searches, I always find them in Google just by using one or two words. But Google is not a recognized resource when you are going to publish it in a journal. So coming on to what kind of research questions can you use in particular databases? So there is no, from a medicine point of view, there is no set recommendations, that this particular question can be found in this particular database. This is because you would find nursing studies published in Medline, as indexed in Medline, as well as in PubMed, in CINAHL, and Web of Science. And you would also find a lot of medical studies, psychopharmacological studies, psychological therapies published in nursing nurse databases as well, such as CINAHL. So, but here we will try to match the question to sources, just as an activity. So, for example, if you're looking for which smoking cessation programs are the most effective for cancer patients. So this is just an example. You can, for smoking cessation programs, you can find this research question, the articles relevant to this research question in Medline. You can find it in PsycInfo. You can even find it in CINAHL, and you're almost always going to find it in Scopus and Cochrane Library as well. So there are no particular recommendations. You know, we always say that this database is suitable for nursing studies or medical studies, but in practice, this is not true. But once you come on to very specialized research questions, for example, what are proven methods for integrating simulators into surgical training? So this is a bit specialized question. You can find this articles relevant to this in Cochrane Library, in Medline. You may not find it in PsycInfo because PsycInfo is related to psychiatry and psychology-based studies only. Let's have another example. When should patients presenting with febrile neutropenia to emergency department be administered antibiotics? So this is a general. This is a research question that is from general medicine, and you would most probably find it in Medline. You would most probably find it in Embase and Scopus and Cochrane, but not in PsycInfo and not in CINAHL, because CINAHL does not really index medical journals that only focus on these sorts of questions. Medical journals to be indexed in CINAHL should have some sort of connection with nursing. Which injection method is the most effective for administering lidocaine? Again, Medline, PubMed are suitable for it. Embase is suitable for it. Scopus is also suitable for it. Which factors improve quality of life for patients post-mastectomy? So this question would come under domain of surgery. It would come under domain of psychology, psychiatry as well, and nursing as well. So you can find this sort of question in Medline, PsycInfo, CINAHL, Scopus. You don't have to choose Embase for it because Embase is more focused on pharmacological and hardcore medical studies. The sixth question, what is the analgesic efficacy for antipsychotic agents for chronic pain? So here you have a component of a randomized controlled trial looking at the word efficacy. Looking at the word antipsychotic, you would note that it pertains to psychology and psychiatry, and chronic pain is chronic pain would correspond to people with chronic pain, which is a medical subpopulation. So can anyone recommend the databases that we can use for this sort of research question? Would anyone like to volunteer? Well, anyone can volunteer.
May I, Amit?
Yes, sure, please.
I think it would go into Medline and PsycInfo. I'm not sure about Embase, but as you said that I'm not sure about Embase.
Yeah, so this question, studies relevant to this research question can be found in Medline, PsycInfo, also in Scopus, also in Cochrane Library. But coming on to, there is a very important point to be addressed here as well. Why do I recommend searching for multiple databases? You know, just to answer this research question, I mentioned 5 databases. Why is it important to to search for particular research studies in multiple databases. This is because, PubMed, CINAHL, Scopus, Web of Science, what when they are developed, and once they start working, then they are in a continuous process of indexing journals, right? So Medline or PubMed, they might have access, or they might have registered an overlapping yet different different peer-reviewed publications journals. For example, if you take PubMed, then it has access to thousands of peer-reviewed journals, right? But Medline is a specialized subset of PubMed. So the Medline indexed journals, although available in PubMed, although all of them are available in PubMed, but not all of the journals indexed in PubMed are available in Medline. So, similar case, if you compare Medline with CINAHL, then CINAHL may have indexed other journals other than Medline. So if you find a particular study in PubMed, then there is a chance that you may not find that study in CINAHL, and opposite can also be the case. So that is the reason we always recommend going for multiple databases. So at least 2 is a recommendation for a good systematic review. But in our experience, we always find that reviewers ask for 4 or 5 at least 4 or 5 databases to search. So the more the databases, the more the reviewers are happy that your database search has been inclusive. So coming,
I had a question.
Yeah.
So regarding searching strategies, sometimes we may need some synonyms to work. For example, I'm forming a research question which has words, and the database might not have the exact words. They have the synonyms of it. So does this database, or the databases that we are seeing here, have this artificial intelligence to search with the synonyms?
At HTRF, we have been trying to we have been trying to find a lot of advanced software and resources that could automate some of these processes involved in a systematic review. So for instance, as you have mentioned, that if we have any sort of resource to search for synonyms, right?
Right.
So there is a particular website. It's called Yale Mesh Analyzer. If you Google for Yale Analyzer for systematic reviews, you can come across that. You will find a lot of synonyms for a particular topic. So what they do is, if you feed in cognitive behavioral therapy, or if you feed in depression as a search term in Yale Mesh Analyzer, what they are going to do is they are going to search for research papers that correspond to depression, and then they are going to extract some synonyms or similar words used in those publications, and then they will recommend that these are the words that you can use. But I do not always recommend using these sources, because as a primary tool, you always have to supplement it. You can use them as a supplement to your manual work, but not as a primary tool. We have also worked with a lot of tools in last 1 or 2 years to automate our study searching process on databases. We also worked with artificial intelligence tools that claim to rate study quality, and they also show in studies, they also show that they can work with good They can work with good sensitivity and specificity, but that is not always the case in psychological therapies, because what we find is that the literature on global mental health research is so heterogeneous that these artificial intelligence tools um cannot really place them. So, for instance, we have a tool called it's called Robot Reviewer. So this is one of the tools. This is the only tool that is based on artificial intelligence that they claim that if you feed in a set of articles, they will automatically rate the risk of bias in your studies, and they would also extract the sentence, the corresponding sentence or the representative sentence from that article, that this is the reason that we have made it low risk of, we have classified it as low risk of bias or high risk of bias. But these tools, we always had to go back to doing manual work. Artificial intelligence and these machine learning algorithms and natural language processing, these artificial tools have a long way to go, and I don't think they are still capable of helping us out in global mental health research. So our previous experiences have not been very good with these tools. So I recommend doing manual work more than supplementing it with artificial intelligence sources. So coming back to the presentation, we talked about previously we talked about breaking down your research question into PICO. So now when we start doing our search in the database, you would understand why is it so important to have your question broken down into PICO format. So after selection your databases, now what you have to do is you have to break your question into concepts, right? Because when you're developing a search strategy for a particular database, then you have to use two sorts of things. Number one would be that each concept that your research question has, for instance, in a PICO format, you have population, right? You have an intervention, you have a comparator, and you have an output. So when you talk about the population, in our research question for CBT for perinatal depression, our population was perinatal women, right? So it would include the concept of this population for perinatal would include words such as pregnant women, such as postpartum women, postnatal, pregnancy, pregnant, let's say peripartum. So all of these synonyms, they correspond to your main concept of perinatal, right? But it's not. It is important to understand that although your research question says perinatal, other authors, the authors that have published primary studies, they might have used any of the synonyms that I have mentioned. So it is important to break your questions into concepts and then identify text words and subject headings for each of these concepts. So for population, you have the set of words. For intervention, it's cognitive behavioral therapy. So one of your keyword would be cognitive behavioral therapy. One of your keyword would be CBT, because authors might have used these words interchangeably. And for identification of text words for each concept, what I always recommend is, just choose 5 or 6 target articles that answer your research question. You can sift through those articles, sift through the text, look at the title, look at the abstract, look at the introduction and discussion. I think I just got a chat message. I don't really have access to chat right now. Someone would like to.
Ahmed, it was just that Dr. Saham was waiting in the lobby. I have admitted it.
Okay. So I always recommend that use 5 or 6 target articles to help identify search terms. So by reviewing those 5 or 6 target articles, you would note that authors use different search terms for a particular concept, and you would be able to incorporate those search terms into your search strategy. So we will do do hands-on practice with this as well, and in next couple of slides. I always recommend that you use a worksheet to keep track of your terms. For instance, just make an Excel sheet, a column for population, a column for intervention, a column for comparator, and a column for outcome. And then you list all the synonyms under their particular domain in order to keep track of your terms. So coming on to the subject headings. So what happens is different databases have different subject headings as well. So subject headings are, let's take an example of Medline or PubMed. They have subject headings called mesh. So what mesh does is that Medline and PubMed, they have employed a lot of indexers on their databases. So for instance, what these indexers do is that they have a particular mesh term called perinatal depression or postpartum depression. So if they find any article that has been indexed in PubMed and that the topic of that research paper is related to perinatal depression, they would index it under mesh. So if you go to PubMed and you want to search only for relevant studies, and you want to you don't want to look at or waste time at irrelevant studies, what you can do is you can just type in depression and look it up as a mesh term. And you would always find that indexers do a very good job at indexing articles appropriate for that particular term only. Embase also has subject headings. It's called M-Tree. CINAHL has CINAHL headings. Cochrane Library has mesh headings. PsycInfo has Thesaurus of Psychologically Indexed Terms, and mesh headings are not available in Web of Science and Scopus. So let me just show you an example. So what if you are interested in, I have an example of two mesh terms here, bird diseases and neutropenia. So these are medical terms, but I have shown them as an example here only. So if you go to PubMed and you look for, you enter in the term bird diseases and you choose the mesh, you choose them to explode as part of the mesh term. What you will find here is, as you can see in the bird diseases, that they have several index terms. Bird diseases, it is subdivided in, it is a major heading here. It is subdivided into avian leukosis, smallpox, influenza, malaria. So these indexes, they have classified the literature according to the topics. So whatever topic you're interested in, if it's tuberculosis, like at the end, avian tuberculosis, just click on it and you will find studies relevant to this particular term only. And if you search for neutropenia, which is a type, so for neutropenia, you would see that that the term explodes as such, that you have all mesh categories, you have disease categories, and then you have the type of diseases here that are relevant to neutropenia. And if you click on this particular term, you would only find literature that is relevant to this particular term. And then when you want to search in PubMed, then you have to, your search strategies are always have to be developed manually. You can also develop them using their own advanced module in PubMed. And there are a set of operators that you have to use in order to search your, in order to come up to relevant set of articles that answer your research question. What I recommend is that, PubMed has scores of these operators and scores of these commands, right? But what I recommend is that fellows or systematic reviewers, they keep in mind two of these operators or commands. So these are called Boolean operators, and and or, right? So what or does is, if you feed in a search strategy or two phrases that are combined with or, for example, smoking or tobacco, what it would do is it would find articles where either term appears. For example, a set of articles in it would have smoking in their title, abstract, or full text. A set of article would have tobacco written only. And another important operator or Boolean operator here is and. If you combine smoking with cessation using Boolean operator and, smoking and cessation, you would only find those articles where both terms appear. So you would start noting a pattern here. For example, for instance, coming back to our PICO question, what our search strategy would require is that we combine synonyms. For example, all the synonyms for population with or. So for instance, your population is perinatal, and you combine all of its synonyms with or. It would be perinatal, or pregnancy, or pregnant, or prenatal, or antenatal, or postpartum, and then you search it on PubMed using this search strategy. And you would come across a set of articles or bibliographic records that have any of these terms. So if you are looking for studies done in perinatal population and you use these synonyms, you would be sure that you have entered in all of the words that authors might use, and that your search strategy has been is very inclusive, and you have not missed any article. For instance, some author might not have used perinatal, and if you did not have perinatal term in your search strategy combined with or, you would have missed those articles. And coming back to the PICO question again.
Ahmed?
Yes.
Ahmed, can you please explain this third operator again? I couldn't understand it. ADJ.
So I'll come to ADJ later on. I'm still on and or. I'll come to these later. Yeah. Because the most important operators
Ahmed, just to add and clarify, perhaps others are also thinking about certain terms when they're thinking about their research questions. So are you suggesting that, for example, perinatal, the synonym for that is also postpartum? Some people use postnatal. Some people may also say antenatal and postnatal in their paper. So what I'm trying to ask you for this operator term of or, so you will have to type in and run the search for just the two words, or you can link up postnatal or postpartum or antenatal or perinatal. So what I'm trying to ask you is to string these words together. This Boolean term will only handle two words separated by or, one at a time. And you will have to run the search strategy with a number of these synonymous words, or you can do it just in one go. Could you clarify that?
So, so all of the databases, they work differently. PubMed gives you an option to manually make your search strategy, where you can just type in perinatal or postpartum or prepartum or prenatal or postnatal in just one sentence, and you just copy paste it in the PubMed search the search line. You can easily find it that way. But they also have an advanced module where you can do it one by one. So it's entirely up to you. If you're an advanced user, then you can do it manually, just like I have mentioned. But if you are just beginning to search, then I would recommend going to the advanced module and doing it one by one. We will, in hands-on session, we will cover these as well.
Brilliant. Thank you, Ahmed.
Ahmed,
Yes.
just I might think it's kind of a contribution, like, there's another term called not Boolean operator,
Yeah.
which basically, if you want to search a cognitive behavioral therapy intervention in low and medium income countries, except, say for example, South Africa, or except Africa region, then probably not is the Boolean operator we can use. Isn't that true?
Yeah. Yes. So I do not usually recommend using not. I have done more than 15 systematic reviews in past 2-3 years, but I have not used not. Uh, I think I used it just once in one of my systematic reviews. And what not does is that if you combine this, for instance, just let us take this example, smoking or tobacco, right? So this is going to find out studies that either have smoking as a term, or that either have tobacco as a term, right? If you take the example of the smoking and cessation, then you would only find those articles that have smoking and cessation together in their title or abstract. So you will only find studies that are focusing on cessation of smoking, right? But what if you supplement this example, smoking and cessation, with not vape, right? So here, if you type in smoking and cessation, not vape, you would find all of those articles that focus on smoking and cessation, using cigarettes or using shisha or hookah, but it would exclude articles that talk about vaping. So the electronic cigarette that people get. So that is an example. That is a very useful operator, but that is seldom used in systematic reviews. I'm not sure about the reason why, but mainly it has to do because a lot of authors may have mentioned that not term in their full text. For instance, if we talk about social support in for example, we talk about social support in perinatal depression, right? And the author might have written that social support is also used for cancer patients, also used in medical student mental health. And what if you write not cancer patients? So you will miss the articles that although are focused on a research question on perinatal depression, but in the full text they mention that particular terms such as medical students, cancer patients, which are irrelevant, but the authors have just given an example in the discussion sections. So there is a chance that you would miss relevant articles as well. So that is the reason we do not really recommend not. But just in case, if you find a lot of articles on, for example, you ran a search strategy and you find out 20,000 titles and abstracts. And although your search was on pregnant women, you find a lot of articles are related to autism, a lot of articles are related to trauma, a lot of articles are based on any other study design that you're not interested in, such as observational studies. So you can always type, in that case, you can always use not Boolean operator, where you can just type in not epidemiological studies, not observational studies, not predictive modeling.
Exactly.
Just to minimize the number of results that you have. But only do it if you have a lot of research studies. And then another operator is this asterisk star, where what it does is, if you use this star in PubMed, as an example shown here, for example, you have a term nurse, NURSE. But you know that authors use words such as nursing. They also use word as nurses. They might not have used the word nurse only, as a singular term. So what you can do here is just type in NURS, and in the end type this this star, this asterisk, and PubMed will automatically search all the variations of that of this term. For instance, if you type in NURS with an asterisk, PubMed would search for nurse, nursing, nurses automatically. And then there are terms such as .tw, right? We also find terms such as .mp. We also have terms such as .tiab. So these terms, these operators, these are used to limit your search, limit your search words to particular sections of a paper. For example, if in PubMed you write in TI, so that would only search that particular term in the title of the studies only. For example, you type in depression, TI, you are only going to get studies that have mentioned depression in their titles. If you mention depression.mp or .ft, then you are going to find articles that have depression listed in the whole text. So this is entirely your choice to make, depending on the type of manpower that you have. That if you limit your search word to titles, then you will find out few number of articles to screen from. If you search for depression in the whole text, then you will find out a lot of research studies that are also irrelevant, and you also have to put in a lot of manpower to search for that particular for suitable research papers. And then we have operators like ADJ. We call it an adjacency term. So what it does is it searches for one term within a phrase, right? So for example, if you write in patient and anxiety, so patient anxiety can be used as a phrase, right? So if you enclose this phrase patient anxiety in quotation marks, you will only find articles that use patient anxiety as a phrase. If you do not enclose them into quotation marks, what PubMed or any other database would do is it would search for patient separately and anxiety separately. And if you combine these search terms with adjacency terms like ADJ3 or ADJ2 or ADJ1, what it will do is, for example, let us take an example, patient ADJ1 space anxiety. So what it would do here is it will find out patient with anxiety, patients of anxiety. It will just place in another term here, one term here. If you type in ADJ2, it would combine phrases that have patient and anxiety and up to 3 words or 2 words within this between these 2 words. So this is also one of the operator, but we do not usually use it in systematic reviews. As I mentioned, we use and, or more frequently. We use a static command operator more frequently. And we also use these operators of TW, TI, AB, where we want to limit the search term to particular sections of the research paper, either to title abstract, or full text.
Ahmed,
So,
hello.
yes.
I have a question. Can we use and or together, say smoking or tobacco and Bangladesh?
Yeah.
Does it work?
Yeah. So let me take you to it. This is just an example that we have. So what we usually do is this is a general plan for your research question. So if you break down your research question into PICO, patient, intervention, comparator, and outcome, you have 4 main concepts, right? So in concept 1, where we talked about perinatal. Search number one, your search term one would be perinatal. Search number two would be postpartum. Synonym number three or search number three would be postnatal or antenatal, prenatal. So these synonyms become your words for concept one, your terms for concept one. For intervention, if you are limiting to cognitive behavioral therapy or psychosocial interventions, then for concept, this becomes a concept two, and you would put in all of the synonyms here, right? And when you translate it to a search strategy, then you combine all of these synonyms for concept number one with or. For concept two, all the synonyms are also combined with or, but these are two separate concepts now. And if you want to combine these concepts into a search strategy, you combine it with and. So as a simple example, we run a search with the population specific keywords: perinatal, postpartum, prenatal, combined with or. Then we search PubMed with intervention relevant terms: cognitive behavioral CBT, cognitive behavioral therapy, psychological intervention. All of these keywords are for your concept number two combined with or, and they would find out articles that have any of these terms, right? So once you have results for search number one, your concept number one, and your concept number two, you can combine them with and. When you combine them with and, you would have all of those research papers that use either of the words from concept one, and either of they would also have at least one word from the intervention as well. So for example, it would make very different, a lot of combinations. So for example, set number one would have search term pregnancy from concept one and CBT from concept number two. It may have postpartum from concept one. A set of research studies may have postpartum from concept one and CBT from concept two. So in this way, you make sure that that your research papers are inclusive of all of the terms for pregnancy. They're inclusive for all of the terms for intervention, and you only get those papers that have at least one word from concept one and at least one word from concept two. And this is the way you end up narrowing down your results. So if you see here, it has been presented as Venn diagrams here. So for example, in search number 5, you would see that search number 1, search number 2, search number 3, search number 4, for 4 different synonyms combined with or, you get a set of articles spanning all of these words. With each article utilizing at least one of those search terms. Similar case for concept number 2, and when you combine them, you would see here that there is this overlapping red circle in the Venn diagram at the end that shows results. So it would only have those studies that have mentioned both the terms and that mention both of the pregnancy terms. So these are only the results that would be included in your that would be obtained from your search strategy. The rest of the studies that mention only pregnancy and no CBT terms, or only CBT terms and no pregnancy term in it, they would be excluded. So this is the way you end up narrowing down your result. Coming down to finding full papers. So you would have access to your University of Liverpool library. So you don't really have to worry about finding full text, because University of Liverpool library has access to all of the major databases, and you find almost all of the research papers full text for free. But just in case you don't have access to these full texts, what you can do is you can just copy paste the title on Google Scholar, and it would bring about search results based on that title. And Google Scholar offers different versions of that particular paper. Maybe that paper is indexed fully, maybe that full text is stored fully in ResearchGate, so it would offer you a link to ResearchGate. Maybe an author's copy has been deposited elsewhere on some university website. It would offer you access to that university website as well. But it is not always the case that you find full text for all of the articles on Google Scholar. So the other strategies that we used to do was, we could always email corresponding author and ask them for a copy. You could always use digital libraries. So I would, as an undergrad student, we did not really have access to a library at our medical school. So I would go to universities, University of Health Sciences. I would go to engineering universities, and I used to have a list of papers in a USB, and I would go there and search for full text individually. You can also use Facebook groups. So these are the groups I have given the links here, and you can always, just copy paste the reference here and ask the users to send you that paper. So a lot of PhD students, a lot of postdoc students are there, and they oblige you with full texts. And then there is a Twitter method as well. So in Twitter, you can just copy paste your title or reference and use a hashtag ICANHasPDF. So what people have done there is that, they have created this trend. A lot of people, even in developed countries, don't have access to full text. So a trend was created in Twitter. You type the title of the article or reference of the article with hashtag ICANHasPDF. There is this automatic page, automatic platform on Twitter, which will retweet your tweet, and people would find it and stored under the hashtag, and someone would oblige you with full text within 24 hours. So I used to do it when I was a student in Pakistan, and this method worked 100%. And then there are some ways which are not very, and which are not recommended to be used in UK and USA. So this is there is a platform called SciHub, sci-hub.cc, sci-hub.bz, sci-hub.tw. So this was a website that was created by a neuroscientist in Kazakhstan, and she was studying in Germany, and she found that it was very tough to get full text from Elsevier or from Springer without spending $40. So she created this platform where you just copy paste the DOI or PubMed ID, and that website hacks through Springer and Elsevier, and you get the full text in a much easier way. But this is not recommended. This is not legal, and this is considered to be copyright infringement. So I would not really recommend it. But I just mentioned this method so everyone would know. Moving on to the hands-on exercise. I know that this was a lot of knowledge, and for beginners, even when I was a beginner, it was really tough to understand how to adapt a research question to Pico and then how to translate them into search terms. But this skill comes on with hands-on practice, and you would get very good in this once you have done 1 or 2 systematic reviews. You would easily become an expert in this. So let us please begin with group activity 1. And what we can do here is I had 2 assignments. 2 assignments for this group activity. What we can do is I can show you the first assignment. I can do it for you, and the other would be done by all the fellows. And then we can have a discussion and feedback on that particular assignment.
And Ahmed, just to interject, if there are any queries that they would like to clarify before they get into this activity, group activity. So any questions any queries, please keep them coming as you go along.
I have a question relating to MES category that you mentioned. How do you actually use that?
Prasansa, could you repeat that by bringing your mic closer to yourself?
Is it okay now?
Slightly better.
All right. So Ahmed, I'm interested to know about the MES category that you had mentioned. So in PubMed, if I want to use the MES category, how do I do that?
Let me take you through to the PubMed. So can you see my PubMed web page?
At the
No,
moment,
Ahmed.
no, not
It's
at the
Teams.
moment.
Let me reshare the screen. Yes, can you see it now?
Yes.
Okay, so I was supposed to, we have next session is on this one, but let me just, take you through it briefly. So I'm on PubMed now. This is the new website offered by new version of the PubMed. Previously, it was a different website. So just click on this advanced. Type in depression. So here you would find, so all fields means that it would search in all sorts of indexing terms, all sorts of, all the sections of a manuscript, including full text, including title, abstract. So when you come here, you click on the all fields drop box, and you would find a lot of different options here. So just go on to this mesh terms or mesh major topic or mesh subheading. All of these are slightly different, but let us just click on this mesh. So what it does here, this is one of the the easier ways to do it. Just type in a term here, mesh terms, add and search. So now you have articles that have been indexed under mesh under this depression mesh term only. So there are around 219,649 49 results. And if you would like to see the exploding term, then what I recommend is doing this. So this comes up with the major heading only, because as I had shown the exploding graph, you saw that there were some major headings, there were some subheadings. So this comes up with the major topic only. If you do it this way, then you should be able to get the major heading again. This is one of the ways for searching for mesh terms. You can also, try to complement it with other strategies. For example, if you want to be more inclusive, you can make it like this: depression, title, and abstract.
Can you show a Boolean operator search like and or? Or?
So, we actually have a session on this next after this group activity. So I'll take you through the whole process.
So I hope, Prasansa, that you understanding how this the new interface of the PubMed functions.
Yes, thank you.
Great.
Before this, we used to have a yes, Dr. Sion?
Yes, Dr. Sion? No, I was just saying that that's good that she has. She now has a bit of an understanding of what this looks like, and you already have a whole session lined up for this.
Yeah.
So over to you for the group activity, unless there are some other questions before going on to the group activity. Umar, may I request you to mute your mic? It's creating a bit of an echo. Thank you, Umar. So any questions before Ahmed takes you through the next sort of the group activity? Brilliant. Over to you, Ahmed.
So let me just open up the file and group activity. So if you have not already downloaded the group activity files from PebblePad, you can download them from the file section on the Teams as well. It has two documents. Number one is GA1-Pico, and the other is on on its model answers. So I'll just
share the screen. Could you share the screen, Em? Thank you. And all of this resource material is available, is there on PebblePad. So I will encourage you to sign into the PebblePad for accessing these materials. But for quicker and quick reference, Ahmed's very kindly uploaded it onto the Teams as well.
So can you see my Word file here?
Yes.
Yes.
Okay, so this is a research question of one of our previous systematic reviews, so, where we studied the effectiveness of psychosocial interventions for perinatal depression in China compared to treatment as usual. And so this is the first exercise where I will break down terms related to perinatal depression, where I will break down this research question into PICO. And then I will show you a model. I will show you a model search strategy for it. And then we have a second research question: effectiveness of relaxation training for at-risk adolescents in treating and preventing depression and anxiety compared to treatment as usual. Where again we break down the research question into PICO and then design a search strategy based on it. So it's entirely up to you what kind of research question that you would like me to work on, because I know that most of you are working in perinatal mental health and not in adolescent mental health. So I can do either the perinatal depression one or the adolescent anxiety and depression one. So should I do this adolescent one just to, you know,
yes, just to illustrate this. Yeah. Let's do this, and everybody pitches in, and then they can do this for their respective questions.
Yeah. So we have, I'm going to break down this research question into this PICO format: population, intervention, comparator, and outcome. So the population is at-risk adolescents. Intervention is relaxation training. Comparator is treatment as usual. And the outcome is treatment and prevention of depression and anxiety. You could also try to modify this PICO framework by doing this. timing or type of intervention. We can also call it type of intervention. And at this point, you could also modify it by adding in the study design. So for instance, we were talking about PCOS earlier, whereas corresponds to study design. We're only looking at effectiveness, so let us just restrict our studies to randomized control trial design. So now we have 1, 2, 3, 4, 5, 6 concepts to work on. So these are just the additional ones, and the additional components of PICO. The PICO is the standard one, and we only added these for as an additional to help us out with formation of a search strategy. So what would your strategy look like? So as we talked about earlier on, your population, all of the concepts would be combined by using using the OR operator. The concept number 2, mention. Concept number 3 is comparator. Concept number 4 is outcome. Concept number 5 would be timing. And concept number 6 here would be study design. So if you search PubMed just with population, you're only going to get studies, you're going to get all of the studies that relate to at-risk adolescents. These would include anxiety, depression, physical activity, trauma. It would include everything, right? But if you restrict it using AND with an intervention keyword, relaxation training, it would only find out articles on at-risk adolescents with this intervention component. So you would only find out articles that have relaxation training as well as at-risk adolescents. We usually don't really write comparators in our search strategy, but it's up to you that you can write in as treatment as usual, but mostly it's not needed. Then outcome, depression and anxiety. Then timing, which would be treatment as in treating adolescents that already have depression and anxiety. And prevention would be that adolescents are at risk. They are still not diagnosed as depression and anxiety, but they are at risk of it. So I just noted it as type of intervention or timing. But what happens mostly is, once we were doing this whole process, we found out that most of the authors, they don't really use terms. Sometimes they don't use terms such as prevention and treatment. They just mention that that effectiveness of relaxation training in depression and anxiety. So if you restrict it too much by using these timings or type of intervention, you might miss a number of articles that are relevant. And the articles that are relevant, but they have not mentioned treatment or prevention. And sometimes you have to do it manually. You have to see manually that if your intervention is for treatment and prevention, you have to judge it manually. And for study designs, I always recommend that you keep study designs in your search strategy, because if you're looking for randomized controlled trials, almost all of the studies following standard frameworks of publication, they mention study designs either in their titles or in their abstracts, and always in the methods of their full text. So keep these 4 terms, 4 concepts in your search strategy. So we'd only work on these 4. Let me just copy paste this table here again, just so I can keep track of the synonyms. So for at-risk adolescents, what kind of synonyms do you think we can add in? Can anyone pitch in with a synonym?
Teenager.
So we can combine it with
Great.
teen. So teen would be teen with an asterisk. It would give us teens, teenagers as well. All of the variations.
Youth.
Young.
So now we talk about at-risk adolescents. Right. So we can add in terms such as that reflect adolescents who are at risk.
Vulnerable.
Also,
And may I request that once you said the word, mute your mics so that there is less echo. Thank you. Keep those terms coming, please. Well done.
now let's go on to the next concept, relaxation training. So let's just I just typed in relaxation, but not all of the. So when we looked at the literature, the key articles we had in our preliminary research, we found out that not all the authors use relaxation as a key term. So they would use types of intervention, for example, imagery, music, because these are the interventions that are used for relaxation as well. Progressive muscle relaxation, or exercise, yoga, tai chi.
Ahmed, why are you using quotation marks sometimes and not in other cases? I mean, is there a rationale for that?
Yeah. So so these quotation marks, whenever you want to search for a full phrase, for instance, if you look for music, it's just a single word. But if you want to look for a phrase that comprises of one or two terms, or two or three terms or more, you need to combine them with these quotation marks. If you don't use it, then PubMed or any other database, what it does is it looks for progressive as a separate term, muscle as a separate term, relaxation as a separate term. And we can add in as many relaxation training methods as we want, but for this you need to look at literature. We even found out that biofeedback was used in it, and lots of other. I'm just using it as an example. Treatments as usual, let's not use it here. I would have used treatment as usual as let's say enhanced treatment usual or treatment as usual. Only when I find a lot of articles that maybe that may be, you know, compare imagery with music, imagery with progressive muscle relaxation, and I don't really want these comparisons in my search strategy or in the articles that I retrieve. So if I mention enhanced treatment as usual or treatment as usual, and similar synonyms for it, then I would only get the term, I will only get those papers that in the full text have these enhanced treatment as usual or treatment as usual as mentioned for control terms. Depress or anxiety or anxious. So this depress, it would include, it would search for all the variants for it. It would search for depression, depressive disorder, or let's say we can also add distress or stress, which are not particularly needed for research question, but they are relevant outcomes. You may also be interested in finding out about suicidality, so you can type in those terms. Or
Should we also include common mental disorder, because mostly we'll also use this term.
Mental health or common mental disorders. And since we are looking for treatment and prevention both, so randomized control trials, they we need to think that if we would like to use treatment and prevention terms here, because even if you don't use this treatment and prevention keywords, randomized control trials that you get would include either treatment or prevention or even health promotion, right? But let's say you just want to focus on prevention, then you can type in here prevent or prevention. This way you will exclude the treatment-based randomized control trials. Or let's say prodrome or prodromal symptoms. Or prodrome, or you can even write it like this. It searches for prodrome as well as prodromal as well. Or if you wanted to just, if you just wanted to focus on treatment-based only, treatment-based interventions only, then you write in, you don't add in prevention-based terms, and you write in only treatment. These are so this is how you just write in keywords in order to narrow down your results or look for specific set of studies only. Or if you have a lot of manpower, then you can keep your search terms broad in order to get more number of results, and you may be able to find in more relevant articles as well. So that happens too. And it's just, trial and error method, sort of trial and error method, where you keep on adjusting your search strategy to get relevant number of articles, to get the number of articles that are that suit your resources in terms of personnel, in terms of funding, in terms of the time you have. And since we are focusing on randomized control trials only, then we can type in here terms such as RCT or randomized controlled or trial. But using the term trial, it would also bring about open label trials. It would also bring about other studies such as pilot studies. So you have to choose your terms carefully. So here, if I was interested in other implementation variables such as evaluation and implementation variables, feasibility, acceptability, then I would just write it as here study design, and include terms RCT, randomized controlled trial, feasibility, or evaluation, or implementation. So this is sort of a rough search strategy we have. Let me show you the final one that we had ended up with. So this was the final term that we had used. So when we ran a preliminary version of our search strategy that pretty much looked like this, that had room for improvement, we came across a number of articles that mentioned other search terms as well. So for instance, we found out that vulnerable adolescent, this term, although we included it in at-risk adolescent concept, we saw that authors use several different terms for it. So we decided later on that we can just add another keyword for vulnerability and show it as a separate concept. So this is a very trial and error method where you sort of adjust your search strategy according to your needs. So what we did in our original paper was that the first concept, we wrote it as adolescent or youth or young and teen, just representing the concept of our population. But we had two choices here. Either we use at-risk terms along with adolescent, or we use at-risk terms separately, right? So we chose that we will use vulnerability terms: vulnerable, poor neighborhoods, predisposition, prodromal, susceptible, prone, high risk, at risk, risk, as a separate term for it. So this is the choice that we made because we found out that we can't really, if we just keep on using it as one phrase with adolescent, we can't really make up for all of the combinations. For example, we can't search separately for prone adolescent, prone teens, prone youth, prone youngsters, and then write in terms like susceptible adolescents, susceptible teens, susceptible youths, susceptible youngsters. So we just made these two concepts separate. So we would, so our search results would come up with all sorts of combinations. It would search for at-risk adolescent. It would also search for at-risk teen. It would also search for at-risk youth. It would also search for at-risk youngsters. And then if you use it this way, it would also search for high-risk adolescents, high-risk teens, high-risk youth, high-risk youngsters, right? So this is the choice that we had made. It would also have been our choice to just add it as such. Prodromal adolescents. You can also use these sorts of terms. So it's entirely up to you. No way is wrong, and you can make your own choice. For instance, if you use it as when we used it as this combination, combining adolescent terms with and using the AND operator with the vulnerability terms, we got around 20,000 hits. But if you use them as combinations, at-risk adolescents or at-risk teens or at-risk youth or high-risk youth, then number one, the limitation would be you would not be able to write in all of the combinations of these terms annually. And another was that the number of hits that we were getting out of it were really less, number of search results. And we thought that getting very few results would make us lose relevant articles that we might have found using this strategy. And the next concept was an intervention. So what we did was we looked at a lot of research papers that had used different techniques for relaxation, and we found out that authors had used relaxation training as a separate method, as a term. They used breathing, they used meditation, they used progressive muscle relaxation, imagery, autogenic training, spiritual, walk, gardening, yoga, massage, acupuncture, self-regulation, music, stress management, exercise, mindfulness. So all of these were coupled with were used to produce relaxation in some way or another. And we also, looked at key papers that talked about relaxation. So those key papers, they only mentioned a few relaxation methods, such as imagery or music or progressive muscle relaxation. but we found out that there were other ways to produce relaxation as well, and we wanted to be as inclusive as possible. So we included all of these strategies in our systematic review. But we did face a lot of problems that are common in global mental health research pertaining to heterogeneity, because we have different interventions lumped up together. So we had to make an analysis plan for it, and we will discuss it in our next module as well. The third concept was related to anxiety and depression. So these are the search terms that we used: anxiety, depression, mental health, well-being, self-esteem, suicidality, stress, depression, anxious, emotion, internalizing, externalizing, or distress, or social. Because we found out that a lot of studies that don't really mention anxiety and depression in adolescents. They talk about internalizing or externalizing symptoms, which come under the transdiagnostic framework as well. So we included these terms too. And then we used the study design terms: control, trial, intervention, or RCT. So these were the terms that we used for our study design, because we were not really looking for implementation variables or qualitative study designs. So this is how we came up with our search strategy, from a preliminary one to a final one. But let me just tell you here that no method is perfect. Even if you use this method, or even if you use this method, both of these methods are correct, and the choice of these methods entirely depend upon you, entirely depend upon the type of resources you have. If you are willing to look into 20,000 research studies or 10,000 research studies, or what kind of time you have. So do we have any questions here?
Ahmed,
yeah.
If I want to make the population, say, location specific, say, for example, the adolescents in Bangladesh or South Asia, so in that case, you have to break it down into two concepts and join with and.
Yeah, then you write in location, geographical location. So when we do research studies on low and middle income countries, then we write in a keyword for every country: Pakistan, or Pakistanis, or India, or Indian, or Bangladesh. So you can do it this way as well. But we have done a lot of we have used this location specific keyword in a lot of our studies. It brings down the results to a lower number, but and we have already published 3 or 4 systematic reviews using this location specific search strategy as well. But what happens is, not all of the papers mention the country. Sometimes sometimes you lose those papers that mention cities only. But it is not possible to, when talking about research papers in low and middle income countries, it is not possible to write all of the cities, all of the towns in all of these countries, right? So we made a choice here, and we just write the country name, just as shown here: Pakistan, India, Bangladesh, and Bhutan, and Nepal. So we go on writing on all of the locations. But but in a previous experience, once we focus on a single country, then we write in all the districts and regions or provinces or states in that particular country as well. For instance, if you go back to the assignment that you are going to do, our study was based in our systematic review was for Chinese population only. So effectiveness of psychosocial interventions for perinatal depression in China compared to treatment as usual. So you would note here that in the model answers, let me just copy paste it in that document. We used search terms here that pertain to all of the major regions of China, because this was easy to do, right? We only had one country to focus on. So we had terms like China, Chinese, Guangxi, Inner Mongolia, Ningxia, Tibet, Xinjiang, Jilin, Hubei, Anhui, Beijing. So we have all sorts of terms here that reflect different regions in China. Just so we do not really lose those publications that are focused that only mention region of China. But it would also depend on the choice of your databases. Because if Chinese authors, Chinese researchers, are publishing in an international journal, they would always mention the location as that this study was conducted in Beijing in China, right? But for this particular research study, we also looked at their local databases, local Chinese databases. So we thought that adding in regions would be best as well, because the authors they may not mention mainland China, they may mention province only. So that is the reason we included location here as well in this way, so that it represents all of the regions of China. But for this large-scale systematic review, where we focused on low and middle income countries only, or global. So if you are searching globally, then you don't need to add in location specifiers. But if you're looking for a particular region, such as Eastern Mediterranean region, such as low and middle income countries, such as South Asia, then it is always good to add in country level keywords. The only drawback here would be that, let me just quote you an example, that in 2016, we had done a systematic review for World Health Organization, and it was about psychosocial and psychological interventions for perinatal depression in low and middle income countries. And we had a very broad search strategy, and we came up with 19,000 search results to screen from. And in the end, we were only left with the 32 randomized controlled trials that informed our evidence. But when we in that review, we had not really searched for number one, we had not really searched in local databases, and we had used country level location keywords, right? So out of 19,000, we get 32 randomized controlled trials. But once we did this Chinese-based systematic review, we got around 5,000 hits, just because we had used these provinces for one country. We got 5,000 hits, and we had around similar number of research studies included. So from China only, we had 32 or 33 randomized controlled trials. And for that, for the other, when you look at the WHO one, where we use country level keywords, we got the same number of randomized controlled trials, the same number of randomized controlled trials. So again, no search strategy is perfect. You're always going to lose important information, important articles. But if you do it in a systematic and reproducible manner, and you try to be as inclusive as possible, I don't think any journal or any reviewer would object to this.
Ahmed, I was just a basic question. Say, for example, in this case, if you get a publication in Chinese language and you have a Chinese people in your team, do you include that as well, or you just be specific to English language?
Yeah. So what happened in the previous WHO review was that we did not have any foreign authors with us. So we only included English language articles. But for this article, which was for the Chinese population, we had several Chinese authors as well, and we included all of the Chinese studies, and we translated them from Chinese to English as well to extract data. So if you have that kind of resource, that translation resource, you must use it, because there is a huge concern about publication bias or language bias, where most of the authors do not really include non-English articles in their systematic reviews, and that does hamper the evidence or limits the generalizability of your evidence. So should we begin with this exercise? What I would recommend everyone to do is, if they like, they can choose to not work on this research question. You can type in your own research question that you're going to pursue in your PhD, break it down your PICO, and then design a search strategy. And we can have a half an hour time for it. Dr. Syama? Hello?
Yes, Ahmed, we can hear you.
Yeah. So would you like to begin with this group activity?
So are we working
Yeah,
on
we
our
can just
presentation?
try our own search for our own.
So what we can do is we can have a half an hour time for this group activity, where you can type in your own research question in this Word document and break it down to the PICO concepts and design a search strategy based on it. Then every fellow can share their screens, the team. So Bangladeshi team can share their screen and share their the work that they have done, and we can then give feedback on it and ways to improve. And the rest of the teams can do the same.
Just a question. So are we working as a country team or just individually?
You can work as a country team. So it's 10:35 now, and we can.
Ahmed, I just wonder, is there, I didn't use Teams before, so is there any chance to create room with the teams so that you can have an individual group discussion?
So I know that Zoom has breakdown those break rooms.
Yeah. Zoom has that option, but I'm not sure about Teams.
Let me ask if I don't think Arsalan is here. Let me check if we can do something about it.
I don't think so. I don't think we can create
We can use Zoom to do our own country teams.
May I suggest that we can look into this option tomorrow as well to create the, I don't think so that we can do breakout rooms. So what would be the best way to go about it?
Syam, maybe we can use Zoom to do our own collaborations and then get back onto Teams when we are ready to present.
Can the country teams do the Zoom thing on their own?
Yeah, we can just open up another window on our internet.
Right, let's try that.
Okay, so it's 10:36 here. We can get back in half an hour. So
10 past?
Yeah, so would that be okay?
Yes.
So we meet up on 11:10
UK time.
Yeah, 11:10 UK time.
Yes.
Oh, okay then. So we'll meet again in half an hour on 11:10 UK time. Then we can have a discussion on everyone's work.
Sure, Ahmed. Sure, Ahmed. Go ahead, country teams. Let's meet up with some work done. See you in half an hour. Hi, Ahmed. I see it's 40 minutes past now. Shall
Yeah.
we try and resume, if the fellows have done some work and can present?
I think have all of the fellows joined us? Yeah, I think we should begin now. If any team would like to volunteer to present their strategy first, then we can then they can share the screen. Yes, yes, Ms. Suma has volunteered. So yes, please do share your screen.
Can you see my screen?
Yes, Uma.
Yes, please.
Okay. So I have written the research question. What is the effectiveness of digital CBT-based interventions for treating perinatal depression and anxiety in low and middle income countries? And here the population is pregnant women or women who have recently given birth. And the intervention is, digital CBT-based interventions. And comparator is treatment as usual, outcome, depression and anxiety. The type is treatment, and study designs, randomized control trial, and location, low and middle income countries. So this is the PICO format which I tried to make.
So, just to clarify in this, for population, you have mentioned that pregnant women or women who have recently given birth, right? So maybe you would like to mention here the postpartum period as well, the 2 weeks or the timing, if you'd like to mention, if you would like to mention the timing. For example, you can mention it in the outcome, just to make sure that even in the outcome, just to make sure that you're fulfilling the definition of postpartum depression and anxiety. Because for first 2 weeks postpartum, you have to see that it's not baby blues. So it's good to have that sort of criteria filled in, so everyone knows that we are talking about the DSM and ICD criteria of postpartum depression and anxiety.
Okay. And I was a bit confused that in population, should we write pregnant women with depression or postpartum women with depression, or just write the population? Because I see my population as not only the pregnant women, but the women with perinatal depression and anxiety. So should we write that here as well?
Yes, because it is a treatment intervention. You're looking at treatment interventions, right? So you should mention that pregnant women or the postpartum women, they already have depression, and we are going to treat it using the digital CBT interventions.
Okay. Okay, thank you, Ahmed. So here in search strategy, I was a bit confused as so let's start with the population. So I've written perinatal, maternal, mother, or rather I should have hysteric mothers, pregnancy, pregnant, or I want to ask here that if they should be pregnant with hysteric, and it will find out pregnancy or pregnant, or we have to write it separately.
Even if you just write pregnant with a truncation mark, the aesthetic, it would cover pregnancy and pregnant as well.
Mm-hmm. Then prenatal, postnatal, and antenatal, during pregnancy, the phrase after childbirth, prepartum, postpartum, antepartum, intrapartum, peripartum. So these terms, which I think are the synonyms which should be included in the search strategy.
Yeah, I think it's a pretty comprehensive.
And then when I was writing about digital CBT based interventions, I found it difficult, and I break it down into separate and want your guidance on it, that if this is CBT or cognitive behavior therapy, talking therapy, psychological intervention, psychosocial intervention, or psychotherapy, counseling. And then in digital, I have written digital, app with hysteric for the application or anything else, mHealth, eHealth, web-based, mobile health. So should I write these terms with CBT separately with all these synonyms, or written it with AND operator?
I think this is the correct approach that you have used. Just one comment in the CBT-based interventions concept, that if you type in psychological intervention, psychosocial intervention, and psychotherapy and counseling, you would get a lot of irrelevant articles. For example, psychological interventions might even include interpersonal psychotherapy. Counseling may even include non-directive counseling, right? So you will get a lot of irrelevant articles. So what I would suggest is write CBT or cognitive behavior therapy as a phrase with behavior, just have an asterisk. So people know, so you know, some of the authors may write cognitive behavioral therapy or cognitive behavior therapy. Yeah.
So Ahmed, I was thinking about our research that, for instance, we have done researches on PM plus and then THP. So we don't write CBT very clearly. We say that it is a CBT based psychosocial intervention. So if we are writing CBT here, it will search those articles which are written that CBT based psychosocial intervention. And in the title or in the abstract, we have written brief psychosocial interventions or low intensity interventions. So you are saying that it will search out those.
Yes, it will. CBT will cover CBT based and you know, similar phrases. You can also add in cognitive, cognitive or behavioral, like you've written behavior with truncation. That's correct. Just add in cognitive. Yeah, so it would cover, you know, some of the articles may talk about cognitive strategies, or you know, how they break down the intervention elements. So they may have mentioned cognitive strategies separately, behavioral strategies separately. So it should cover it. And next, in the digital one, you can add concepts such as social media or internet or smartphone. So another thing would be, you know, that just look for, you know, American and British spelling as well. So you have this behavioral, right? So you can just delete R, and after O you can have the asterisk. So it would cover behavioral with a U as well. Yes, Dr.
Yes.
Just thinking, and one is a clarification from Huma, and then just thinking aloud. You want to specifically restrict your systematic review on cognitive behavioral therapy based interventions which have been digitized. Is there a specific reason for such a specific CBT base only?
Actually, yesterday I have written it as psychosocial interventions, and today Ahmed told that if the topic is narrow, it is more like organized, and we can search for the more relevant articles. And then I think of that I'm focusing on mainly the CBT based interventions. And if it is perinatal mental health, we can have psychoeducations for anxiety specific, fear of childbirth therapies, and relaxation therapies, meditation, yoga. So I was just thinking that if I will include the psychosocial interventions, maybe it will include more of the psychoeducation articles, which I think are not very much relevant to my interest. That's why I narrow it down to this aspect.
Right.
But it is open for discussion. If Ahmed and you think that psychosocial interventions here, because I have narrowed it to digital. That is a very specific category. And if I am doing CBT based, I'm not sure if I'm narrowing it too much.
Right, and no, that makes absolute sense. And narrower, more focused, the better. That's absolutely fine. Then may I also suggest in your, and this says do read up, do try and see what the literature also suggests. Recently, literature that is surfacing is saying that one of the most active ingredients within CBT-based interventions is the behavioral activation component. And in terms of CBT, I think what drives your question is I completely understand, and the kind of context that you're working in. But may I also encourage you to read around because what we are generally trying to use does have cognitive behavioral techniques involved. It may not be the purest form of CBT. So we do borrow from behavioral activation. We also borrow from other, but the main crux, even of Thinking Healthy program, is based on the CBT principles. So I'm just saying that do read around, and this can you can search these you can add these terms to the search item and see what relevant, or perhaps like Ahmed is saying, some irrelevant papers also come up. Similarly, I would also encourage you to think about when you define or try and put terms against digital. A lot of CBT digital things are based on self-help manuals. So you should try and also try and see if there are chatbots, the kind of work that we're trying to incorporate into our digitizing of the interventions, so that you can, widen the net, so to speak. Chatbots, avatars. I don't know what the technical term. I don't come from a digital background. Perhaps Rabia and Afan can help you. What this type of technologizing of the intervention materials is called these days. Yeah. So do add that too. So I'll stop.
Okay. Thank you, Dr. Sam.
Just one more thing to add. If your focus is on on the active ingredients rather than the whole therapy, then I think you should also add search terms like, as you have written, behavioral, cognitive, but you can also further add in specific behavioral strategies and cognitive strategies, such as cognitive restructuring or identification of affect or these sorts of behavioral and cognitive strategies. So there is a paper published by Daisy Singla, Psychological Treatments in Low and Middle Income Countries. She has a paper on it, and she has given a very good taxonomy where she gives, where she underlines or identifies different active ingredients in all the therapies. So she has given behavioral type of active ingredients separately, cognitive type of ingredients separately. And I also have that list, and we have further refined it. You can have that from us, and also add those specific strategies as your keywords.
Okay, thank you, Ahmed. So
just one more thing to add, because a lot of these papers, when you talk about ingredients or strategies, they would be multi-component. So even though they would be mentioning it as CBT based, they would have a lot of psychoeducation based strategies as well, social support, But just if you add in behavioral and cognitive type of ingredients, then I think that should suffice. And you should be able to get all of those articles that have these specific ingredients as part of our multi-component intervention. So it should be pretty comprehensive.
Thank you, Ahmed. So for depression and anxiety, it is not much different, which we have done earlier. Depression, anxiety, mental health, well-being, stress, distress, anxious, common mental disorder, common mental problems. So I should have also written common mental health, I think. So these are some of the related to depression and anxiety. So here I also mentioned, yes. Yes, Ahmed.
I said it looks good, but don't add this common mental health. Just add common mental disorder within aesthetic, and common mental problem within aesthetic.
Okay. Okay, and here I have mentioned treatment, but I'm not sure if I have to mention it or not. So it's treatment, treat, intervention, care, therapy. So as we discussed earlier that you didn't mention it, so should we remove it from here? Because here I'm not focusing on the preventive ones, so I have written this treatment.
I think based on our experience, we don't really add treatment or preventive as a separate word, because a lot of the authors, they don't really mention if it is treatment or prevention, and we have to manually classify it, just by looking at the population. If they already have depression and they're getting CBT for it, or if they don't have depression, they are just risk or just showing some higher scores on different scales, showing prodromal symptoms. So we classify it as prevention. But the authors themselves sometimes do not really classify these interventions as treatment or prevention. So we don't really type in these terms.
Okay. So in the study design, randomized control trial, RCT, randomized control trial, randomized controlled, effectiveness, efficacy, control trial, intervention, clinical trials. So
for words where you type in S, just type in aesthetic, and you can also, if you want to include cluster randomized control trials, you can also write them. But they have we do combine randomized control trials with cluster randomized control trials, but we have a separate tool for assessing risk of bias in them. But we do include these studies.
Okay. So last one is low and middle income countries. And I've just taken it from one of your review, as you have mentioned all the countries there. So I just entered these keywords, LAMICs, LIMCs, and low and middle income countries. And then I have just borrowed this from one of your review, all the countries.
So I would just add in with LAMIC, just remove the S, truncate it similarly with LMIC, and keep the low and middle income countries in quotation marks.
Okay.
I had actually copy pasted it from Jane Fisher's paper research.
So this is what I have written so far, and we can discuss it later then.
Yes, just one thing, in the countries, when you have the Sierra Leone and Ireland, do mention them in quotation marks, because sometimes even I forget to type in quotation marks with these Solomon Island and Saint Vincent, and
Central
reviewers
Africa.
will be very quick to point it out.
Okay, sure. So that's all from my side. And
well done. Well done.
It looks pretty good. Excellent work.
Thank you.
Great.
Thank you.
Well done. So who's up next?
I can go next if you want.
Yes, Nabi. Lovely. Please do.
Yeah, sure.
Share your screen. Over to you.
Is it visible?
Yes, it is now.
Yes, it is.
All right, okay. So basically our research question is, what is the effectiveness of CBT-based interventions in treating prenatal depression in slums? So as I break down into PICO, the population will be women with prenatal depression in urban slums. The intervention will be CBT. The comparison will be treatment as usual, and the outcome would be treatment of depression. And as I try to find some concepts of or antenatal or postnatal or childbearing or mother, I put it star. It can be S as well, female. Okay. And in part of location, I put urban. I didn't mention any country specifically, is because we are planning to have, bring all urban slums into the coverage. So urban or slums are squatter settlements. I'm not sure if it is hyphenated. Do I need to put inverted commas as well, Ahmed?
Yeah, you can choose between hyphen or quotation marks. Just choose one of these.
Okay, great. So our cities are low income urban housing or urban fringe or favela. There are some words which is also used like bastis. So if it is in is a foreign word also used in English literature, in that case, do I need to put it under inverted comma or just a word?
Yes, if you have seen studies, that mention these terms,
yeah,
then you can use them in your search as well.
Okay. Shantytown, Jogis, Hovel, or inner city or metropolitan or town, and the intervention would be CVT or behavior. I just learned from you, like, I put a star, behavior therapy or cognitive behavior therapy or counseling or manualized or structured therapy or psychology or psychological therapy or therapy or instructions on non-specialized health workers or community-based intervention. I'm not sure, do I need to put comparator treatment and user also in the
No,
in
no, I don't think you need to. No, I don't think you need to put it.
So about the outcome, depression or reducing depression or anxiety or reducing anxiety or child development or child nutrition. And for type, we put RCT or randomized control trial or clustered randomized control trial. And this is, comes look like this. And we did try with mesh term on PubMed, and we found around more than 5,000 articles after this search.
It is a pretty good number in PubMed. But if you consider searching the same on a number of databases and several databases, then your search results may jump to 10,000 plus.
Okay.
So I would recommend, just try to cut down some of the words here that may be a bit irrelevant. That may lead to, you getting irrelevant results. For example, female, that is too broad of a concept. Mother, if you write new mother as a phrase, then that's a different thing. Yeah, just type it in a phrase. For pregnant, you can just remove the T and truncate it, so it includes pregnancy as well. And then there were some more terms, such as there is postnatal. Postnatal is there. Perinatal is peripartum. You can add peripartum as well. You can add. And then, so if you search studies like inner city, metropolitan, or town, then these can include studies in towns, inner cities, and not among in slums. So I think your words such as urban slums, if you just type it in hyphen, or slums, or squatter settlements, no cities, don't add cities, because it's too broad of a term, and it would bring about irrelevant articles. Low income urban housing, that's good. I think rest of the inner city, metropolitan, and town, they're also very broad terms. And we have searched a number of because we have done 4 or 5 systematic reviews on psychological and psychosocial interventions as well. And because we don't really focus on a single therapy, and we rather focus on all of the psychosocial and psychological interventions in one systematic review. So we do get a lot of problem with heterogeneity that automatically downgrades the quality of our evidence. So I think it is really good that you have focused only on CBT, but just run a search first in order to see that you're getting at least 3 or 4 articles, minimum number of articles, because it is going into your PhD, right?
Okay.
So you should have some content. It's okay to even have 1 article or no article for a systematic review, but it would just be a barrier in your PhD. You focus on this.
Ahmed, can I just say, can I just comment on one thing?
Yes, please.
Yes, please.
Yeah, we worked on this together, and what I did was I did a much more limited of terms. And it turns out that if you were to use just the first term from each category, we would end up with somewhere between 5 and 16 articles, of which if I were to just look, and I did a quick look at it, if we just were to limit it to randomized controlled trials, in slums, you end up with somewhere in the region of like 2 or 3 articles.
Yes.
Again, if the key step is a randomized controlled trial, then immediately it's going to cut it down to less than 10.
Yeah, so that's not a very high number, but when we were running these sort of systematic reviews, we don't really get a lot of articles from slums. Maybe that's because we don't really focus on our reviews don't really focus on slums, or maybe we lacked keywords related to slums. That may be a problem. That may have been a limitation of our reviews. But do conduct, if you find that number of randomized controlled trials is too less, you can even go on to add in pre-post studies, those sorts of studies, or open label trials or pilot studies. And in the end, when you're doing meta-analysis, you can present evidence from RCTs as a subgroup and from quasi-experimental studies or quasi-RCTs as a separate group. So that can be a good strategy to give a good recommendation based on your systematic review, even though you have non-RCT based.
May I?
Yes, please.
I was just going to add that I thought you had said earlier that it was okay to have even 2 or 3 RCTs, because RCT is really the gold standard in terms of quality. So I'm just curious about that for the PhD. Even if you have like between 1 and 5 RCTs, would that be enough, or would we then have to include other kinds of studies just to bring up the numbers?
I think 5 is a very good number. 4 is a very good number. Even 3 is a very good number. But if you have 1 or 2 systematic review, 2 articles in a systematic review, even then you can publish it. But I'm just saying it as for the sake of the PhD dissertation, because I'm doing a PhD myself, and that also worries me, that when we talk about the content and length of a dissertation, or what kind of insights or what volume of insights do I want in my dissertation. So that's really up to the fellow or the systematic reviewer. If they want more number of articles, they can expand the criteria to include randomized controlled trials as well as open label trials or pilot studies. It will downgrade the evidence, quality of evidence of your system that your systematic review presents, but there are further ways when you perform advanced meta-analysis. For example, you can perform subgroup analysis, you can present results of non-RCTs and RCTs separately. So in that way, you have a good ample volume of evidence, and also your quality of evidence of your systematic review would not be downgraded. So that's one of the ways. But it is perfectly fine to have 1 study, 2 study, 5 studies in your meta-analysis. It's perfectly fine, and it only depends on the systematic reviewer. What he wants out of the systematic review, and what brings him more satisfaction. Because in my case, I would have included non-experimental studies and went for and go for complex meta-analytical methods.
Right. Thank you, Ahmed. And may I ask the Bangladesh team and Umar to also think, because what in their minds is the actual question in terms of jhuggies or squatter settlements that will somehow or the other put some challenges or diminish the effect of known CBT-based type interventions. What is the exact thing which they want to understand? Because my understanding is that CBT-based interventions are generalizable. They hold external validity quite a lot, quite high on external validity. Perhaps within such Scotlands or jhuggies, what is it that makes it challenging to deliver such interventions? Is that the question? Or the question is that, because I would like to understand what is it that in their minds, what's playing behind this question of the systematic review? So I'll stop here. And this is just to help facilitate further thinking and perhaps adding or refocusing this question. I'll stop.
May I, in response to your question, Siham? So, hello. Okay, so it's basically the uncertainty of the settlements and their lack of resources, and the difference between different type of lower income households which may have impacts even on a standardized procedure or protocols. So that is what we wanted to see in this by focusing on urban slums.
So you're basically you're thinking, Shamoon, that perhaps what sorts of challenges, overcrowded, low literacy settlements may put up as challenges to delivering evidence-based interventions. If that's your question, if that's the question, then, and we can run this by Ahmed, then Shamoon, you don't need to restrict yourselves to RCTs. Then I would want you to look at even more process evaluation based papers, formative qualitative based intervention papers, which draw out such challenges. Challenges of implementation, challenges of retention, challenges of being low literacy, challenges of the delivery agent. Yeah, who'd be the most appropriate person to, in such congested, at times very, very transparent, without walls kind of settlements. So then your study designs may also include those formative like papers. So perhaps that will change the focus.
If I may add, I think we're still formulating what our issues are, but I think what we are really starting off with, you're absolutely right, that I think slums are a different setting than other poor areas. They're certainly a different setting than rural areas. So if anything, I'm actually open to the idea that things in slums may even be better, that some interventions may work better in slums than they work in rural areas. So I think we're not, because there's so little evidence that in terms of generally in terms of urban healthcare, some of the work that we're doing in slums already have started to refashion our thinking about slums. So it may in fact be the issue that slums may be better off than what people think they are. So this is part of this whole process of trying to understand what people in slums are like and what is it that affects them. And at least some of our preliminary work in other non-mental health areas is surprising that in fact they're turning out to be better than other low-income people. So you're absolutely right. It could be that it's not so much a challenge, is that there's something about it that they're different. And because they're so close to the rest of the city, they have access to certain many of these services geographically. So yes, maybe we should focus on what makes it different. And I don't know whether that means that we should look at non-slum areas to do to do trials or not.
Umar, may I also suggest, I completely now understand, and I think this is a great starting point. And whatever final sort of question gets formulated for this systematic review exercise, and inshallah, and hopefully paper as well, eventually. So what I would, this will directly, that's my sense, this will directly then feed into whatever adaptation your Thinking Healthy program or of sorts interventions will require when you will take them to such settings. So this should inform the adaptation process as well, this systematic review, I mean. So I completely take your point, and we should keep brainstorming. And absolutely, this is the first pass at Nabi and Shamoon and yourself and Bangladesh team trying to pitch the first question. And this will get this will evolve. That's what I'm saying. So brilliant start, and thank you for clarifying what exactly is that that needs to be seen. So thank you. I'll mute myself. Over to you, Nabi. Continue, please.
I'm basically done with what I did with this such a strategy. Ahmed, if you have any more feedback.
I think if you are going to focus on mental health of slums, and you're trying to see, what treatment works best and in what context, as Dr. Siham was mentioning, then I think, and you may also find out the literature on CBT in slums is limited. So keeping all of these points, I would recommend that what you do is you throw a broad net, include all sorts of psychological and psychosocial interventions aimed at anxiety and depression of people living in slums. And so this way, what you will get is, in your analysis, you can provide estimates that maybe CBT is more effective than IPT, or CBT is the most effective treatment when you compare it with any other sort of psychological or psychosocial therapy. So that can be one way to go. And this would solve your problem with heterogeneity as well, because you're trying to compare different therapies. And then I would also suggest that, as Dr. Siham mentioned, that you focus on implementation indicators as well. How was the uptake? What were the barriers to recruitment? How were things like fidelity checked? Was the intervention manualized or not? Were there any barriers to the setting used for delivery of intervention? What type of delivery agents were used? And then you can compare things like, if non-specialists, if the effectiveness of therapy delivered by specialists and non-specialists is similar, or if there are any differences. So, you can look at these implementation indicators as well. And if you want to go for a mixed methods review, then of course you can include qualitative studies as well. And, just describe in a narrative manner or in a thematic analytical manner that, how the intervention helps people living in slums. If there are any themes arising from the data, for instance, maybe they recommend that they have you can get a lot of themes, just looking, mentioning things like how therapy helps them, how's the stigma, and if they have given any recommendations, which you can then provide as your own recommendation, that people living in slums did not like the component of this component of the intervention, that they want setting to be like this. So I think that would be a very significant contribution to literature, a very good body of work that can further, inform intervention development, and also inform the implementation processes that work the best in slum areas.
Thank you, Ahmed.
Ahmed, can I just ask you a question? If we were to broaden the net and include low-income populations, which are both rural and urban, and in a sense try to understand the question as to whether there's something particular about slums which make these interventions either easier or more difficult to implement, would that be, but limit ourselves to randomized controlled trials, would that be something that would be workable, or because it seems to me that one of the things we're trying to understand is what makes slums different. So we need to compare slums with people who are equally poor but who are not living in slums, like in the rural poor.
Yes, that can be a way, but if you only restrict yourself to only RCTs, then the problem would be that the only major finding you're going to get is about effectiveness. If that particular intervention is more effective in slums and less effective in other low-income populations. I would recommend this if you're trying to understand the processes involved in slums, then I would recommend that you go for a mixed methods review with qualitative literature from the slums and effectiveness literature from the slums, and broaden the net to more psychological therapies, so you can actually see if some sort of therapy is better than the other. So at HTRF, now what we do is we don't really look at therapies now, we look at active ingredients and their combinations. So for instance, we give recommendations like, CBT, behavioral strategies combined with exercise, or behavioral strategies combined with social support is better than let's say than cognitive therapy, cognitive strategies. So that can be a component as well. What kind of active ingredients work the best in slums. And we have developed some frameworks for that as well, some advanced frameworks, and we will share it once we start on that route if that is needed. So, but I would recommend that just taking these advanced frameworks and to inform, to have a very good contribution to it.
Thanks, that's very helpful, and we'll talk among ourselves and see where we end.
Okay. Thank you, Ahmed. I'll just close my screen share again.
Well done, Nabi. Thank you, Shamoon. Thanks, Umar. We'll continue discussing this. So which team is next up? Yes, Prasansa, go ahead. Just keep as close to the mic as possible.
Sure. So is it okay now? Hello?
Yes, it is okay.
Okay. All right. So our research question is, what factors improve treatment adherence and treatment satisfaction for women with peripartum anxiety to community-based psychosocial interventions delivered by community health worker in low and middle income countries compared to the control group? Quite long, but then, yeah. So that's how we have framed it. And as for the population, it would be women with peripartum depression and anxiety. Intervention would be community-based psychosocial interventions delivered by community health worker. Be control group treatment as, and outcome would be treatment adherence and treatment satisfaction. And setting would be low and middle income countries. So, well, as for the search strategy for peripartum women, we've come up with maternal or peripartum or perinatal or pregnant, and then I had put this asterisk mark just to broaden our search terms to pregnancy or pregnant or any other things, and or antenatal or antepartum or postnatal or postpartum and new mother, recent mother. This is quite awkward, but then we thought of putting so post-delivery or post whatever. So we've put an asterisk mark after deliver, and the other one is intrapartum. So as for depression and anxiety, it's depressed or So for anxiety, I have put an asterisk mark after ANXI. So I don't know whether that would work or not, just to be sure that it covers anxiety, anxious, or any other variants. I don't know if that would work, but then yeah, I would love to hear about your thought on that. And then or distress. So if that works, I would just cut it off. And the other one is stress and tension, because I have read quite a lot articles, especially in terms of Nepal. Depression symptoms are often expressed as attention. So we thought of putting it here as well. And the other one is common mental health problems, or common mental health disorder. And for the community-based psychosocial interventions delivered by community health worker, we've broken it down into two different concepts. So for community-based psychosocial interventions, since this is focused on peripartum depression, we've come up with a Thinking Healthy program, interpersonal therapy, interpersonal psychotherapy, problem management, relational therapy, healthy activity program, behavioral activation, cognitive behavioral therapy, other variants of behavior, and then psychosocial intervention, psychoeducation, group therapy, individual therapy, non-pharmacological or psychological. And since we want to basically focus on the services delivered by community health worker, we have broken it down as a different concept. So for a community health worker, we would be, so these are some of the search terms that we've come up with. So the first one is non-specialist, tax sharing or tax share, whatever variants it has, and then tax shift with asterisk mark, and lay community health worker, or health volunteer, lady health worker, female community health volunteer, especially in focusing in Nepal. We have this term used a lot, so we've put it here: barefoot counselor, community psychosocial worker, or psychosocial worker. As for the control group, I don't think we would be using it as a search term, so I've cut it off. And since we want to see whether it has any, we are focusing more on treatment adherence and satisfaction. We've broken it down into two different concepts. So for treatment adherence, we have care continuity or career continuation or whatever variants. And then maybe we would be interested to know about dropout, treatment alliance, treatment adherence, or treatment compliance. So it could be either T or C. We've struggled on this a lot. So, but then we have come up with this satisfaction improvements or whatever. So I don't know whether this would work again. So satisfaction after F, I have put an asterisk mark. So yeah, and the other ones are like symptoms reduction, functioning, or cost effectiveness. Maybe these are some of the areas we would be interested to work on. We would be interested to read. So that's why we've put it here. And low and middle income countries. So LMIC or LAMIC or South Asia, Southeast, low income developing countries. And I guess it would be interesting to have all the countries list as Huma had presented earlier. And as for the design, since we would be interested to know about the factors associated with treatment adherence and satisfaction, we have broadened our review to qualitative as well. It is RCTs, CRCT, and qualitative. So yeah, that's it. Hello.
Yep. Hello.
Yes.
Yes. Could you please take you to the first page of the document?
Sure. All right.
Yes. So I think you have done a really good job with the PICO framework, and it's really comprehensive, and there are nothing to improve in this one. If you go on to the search strategy, can you please go to the search strategy? So I think you for the outcomes of treatment adherence and treatment satisfaction, you have to list them in as or, combine them as or. Do not list them as separate concepts, because both of these are outcomes, right? So you need papers that either have treatment adherence or either have treatment satisfaction. And here you also need to think about the definition of your outcome, because I see you have noted a lot of outcomes such as cost effectiveness. So does cost effectiveness come under the category of treatment satisfaction? Functioning cannot be listed as treatment satisfaction. Symptom reduction is not treatment satisfaction. So you will have to develop an operational definition of your outcomes, because the reviewers, they would ask for it. How are you going to define treatment adherence? Are you looking at does treatment adherence mean that you're looking at if all of the sessions have been attended, if 85% of the sessions have been attended? How are you going to define these outcomes? With depression and anxiety, it's easy because we have the ICD and DSM and all the clinical criteria to diagnose them, right? Then for the community health worker, so are you looking at community health workers only, or are you looking at non-specialist workforce?
So we are only focusing on, we would like to focus on the non-specialist.
Yeah.
So yeah, that's why we have all of these as search terms.
So I have just listed some of the search terms that we had used for non-specialists, because if you're talking about community health worker, then that's a subset of non-specialists, right? A non-specialist can include any non-mental health professionals. They can include teachers, volunteers, social support groups, self-help groups, policymakers, nurses, aides, lay health workers, human resource, health manpower, community networks, caregivers, allied health personnel. So if you're looking at community health workers and specifically, then your search terms are good. But if you're looking for non-specialists in general, then I think you can add these terms as well.
Sure.
So I have just posted it as a table. And then coming to the, can you take it a bit upwards to, yes, the interventions. So your intervention category is community-based interventions, right? Can you go a little up to the intervention category of your search strategy? So here, I think you don't have to write Thinking Healthy program, because Thinking Healthy program, I know trials published from Pakistan that mentioned THP, from India that mentioned THP, and I saw one paper from South Africa that mentioned THP. And now, in Kenya, we have Eric Green working there. He mentions THP as well because he's digitizing the intervention. So it's okay if you have it here, but the reviewers may ask, why do you have a term here, significant name of the therapy and not specific names of other therapies, because there are a lot of other therapies as well that are delivered for perinatal anxiety and depression. I have also copy pasted some suggestions for your therapy, because you're looking at psychosocial interventions that are community-based, right? So in addition to interpersonal therapy, interpersonal psychotherapy, problem management, relationship therapy, cognitive behavior, psychoeducation, group, individual, psychological. So with psychological, just write in therapy. If you just write it separately, psychological, I'm not sure how much. But it's okay. Non-pharmacological and psychological both are okay. You can also write in non-directive counseling, psychological debriefing, supportive interactions, tangible assistance, non-specialist mediated, group sessions, multi-component, holistic, community, just as a separate. So I have the list, you can just copy paste it.
May I know where did you paste it?
In the chat box.
I'm so sorry. Unfortunately, I don't have this access to the chat box. So since I'm using my office Teams, so it doesn't allow me to use the chat box.
What I can do is I have, we have done 3 or 4 papers using these search strategies. So I'll just send those papers to you. So you'll have more idea about, what types of search terms to use and how to write the operational definitions of outcomes. So I'll just send those documents to you through email.
Sure, thank you.
Well, great work done.
Ahmed,
We will.
Yes, Ahmed, may I suggest use PebblePad to post all these resources so that they're at one place. I think other fellows will also get helped if they have they're privy to the search strategy papers that you're referring to. Thanks.
So we had done 4 or 5 systematic reviews and meta-analysis on perinatal anxiety and depression. So I'll just post all of those systematic reviews and meta-analysis so everyone, they can use them as case studies and, just learn something from it and use it in their dissertation as well.
Sure. So before I end my presentation, can I ask whether this would work? Like for the variants of anxiety, can I use ANXI and then asterisk marks? Would that work?
Yes, it would work, but PubMed, it would only give you top 600 variations for it. After 600 variations of this word, they are not going to give you any more variation. So do keep that in mind.
All right.
And I think it's better to just write anxiety or anxious.
All right. Thank you.
So the next team, I think we have the last team left, right?
Hi, thank you. Can you all hear me?
Yes, we can.
Oh,
Yes, Prashani.
so
Go ahead.
okay. So in our Enhance Sri Lanka project, we are planning to implement adapt and implement THP and test whether it is working in Sri Lankan setting. So under that project, we thought we could do a systematic review to map changes and adaptations made to THP in other South Asian settings, and what they have made, what are the changes they have made according to different risk factors and cultural aspects. So when we are discussing this topic further, according to our setting, we thought maybe we need to discuss this topic further with our supervisors before selecting it, particularly for this systematic review topic as the systematic review topic for the PhD. So because in Sri Lanka, we have primary healthcare workers who are working in the ground level, but they are currently overburdened. So we are not very much sure whether we need to go with them to deliver the intervention. And so we are not sure with whom we should deliver the intervention. Perhaps we can involve their partners, husbands. So for this moment, we thought we will go with the second topic. Hope you can see. That is about systematic review to assess prevalence of paternal perinatal depression in South Asian setting. The reason we thought of this was not only mothers, fathers also have experiencing perinatal depression, and in Sri Lankan setting, mostly not only women but fathers also have to participate to antenatal clinics, and they also going through the kind of same process. So for this activity, we thought to this topic. So the question is, what is the prevalence of paternal perinatal depression in South Asian setting? And also we thought it would be beneficial if we can look at what are the risk factors for paternal perinatal depression in Asian countries. So, but when we try to put it in this format, we noticed that for prevalence studies, we can refer this COCOPOP format, and for risk factors, it is PEO. So we divided it into two projects. We are not very much sure whether we can combine these two as one project. So when we come to this topic, we thought the population is perinatal fathers and the condition is depression, and the context is South Asia. We thought if we take LMIC, it will be like we need to narrow it down. So we thought to keep it in, limit it into South Asia, and the outcome of this assessment will be we are going to assess the prevalence of perinatal depression. So these are our search terms. So for perinatal, we selected these words: perinatal, antenatal, postnatal, pregnancy, postpartum, childbirth, antepartum, puerperium, those the terms. And for fathers, we thought we should include father, man, dad, spouse, those kind of words. And also male, we thought it would be beneficial to include one term as male. And for depression, we selected these terms. And for South Asian region, we decided to use terms for each country, as well as we thought maybe perhaps SARC would help. We have to check it. And for prevalence, we thought prevalence and rate, incidence, ratio, percentage, those terms would help. So here is the search strategy written so far. I think after seeing others' presentation and the answers given, we surely can develop this. For example, we may need to, we can improve this like for perinatal. Hello? Hello?
Hello. Yes, your voice is a bit distorted, but we can hear you.
Okay. Okay. First, shall we combine these two systematic reviews into one project? Can we include prevalence one and risk factors one together under the same systematic review?
You're talking about combining prevalence and risk factor zone, right?
Yes.
Yes, of course you can do it. And yes, for this, and I think if you do it, it would be a very good contribution to literature as well, because I don't see a lot of research studies on paternal perinatal depression. So and the approach you have taken so far, I think it is correct. You have listed all of the synonyms that can be related to these, to paternal, to fathers, to perinatal period, to depression. The countries are listed in, but I think you can, what you can do here is you can just improve prevalence and risk factors related terms. So you have prevalence, rate, incidence, ratio, percentage. I don't think you should include percentage, ratio, percentage and ratio. Just add in prevalence, rate, incidence. You can also add in terms like risk, or term and phrase risk factor. You can in the same just add it in the prevalence one. Yeah. So risk factors, epidemiology. So you can just write epidemiolog with the truncation with the asterisk mark, and you can add in correlate, predictors, factors. You can also add in cross-sectional, longitudinal, prospective cohort, retrospective. So you can add all sorts of words. We can also add in odds ratio, relative risk, those sorts of terms. So you don't really lose anything. So I think this should be a comprehensive search strategy. But one thing I would recommend is that since you're only focusing on South Asia, you should also try including some local databases as well. For example, in Pakistan, we have PakMedinet. I'm not sure about rest of the countries, but you can look at what sort of local databases they have.
Okay.
And try to download results from there as well. So your search strategy and the search process will be very inclusive.
Okay, thank you.
I think it's a pretty good job, excellent job done.
Well done, well done.
If we have time, can we look at the first one as well?
Yes, the first one. In the first one, I'm just because I know that we have a lot of work done on THP in Pakistan, in India as well, but I'm not sure if you're going to find out a lot on manualization adaptation process done in rest of the countries. For instance, as I talked about, I actually have a list of all of the countries where which have published papers on THP, and I can share that that list with you as well. So you may, yeah, I'll share the list with you. So you know that you know what kind of literature has already been published on THP, and if you can truly, if there are there are ample RCTs, so you can compare THP with adapted THP programs.
And if I may also add very quickly, and this is for everybody, yeah, is the fact that these are contributions, these are scientific contributions that we will all be making to the literature, to the existing literature. You will plug in some gaps in the global mental health literature as well. So keep that hat on as well when you do these systematic reviews. Yeah, I'll stop here.
Thank you, Sneha. I'll stop sharing my screen then. Thank you.
Once we start the systematic review process, not only will I share a lot of the work that we have done, I will also share a pool of words that we use. For instance, a pool of search words that we use for study designs, for implementation science variables. So all of you, you don't really have to worry about lacking on that aspect. We'll share all of the words with you, which you can use and further augment them.
Ahmed, can I ask a question about searching, which is confusing me?
Yes.
Yes. When we put in the search terms, like, in using the PICO format, if you put in and RCT, shouldn't you only get results which have RCT? Because I'm noticing that even if when I'm putting in and RCT, I'm getting in non-RCT studies as well. And when terms are sort of synonyms, we separate them with or, and we use like brackets, or what impact does that have?
So the brackets, they are only used to combine synonyms. For example, open bracket, and then you write depression, or depressed, or anxious, and then bracket close. So between or terms, you do not really have to add brackets, just have ends.
Okay. But
and
just do a search string which have and use a particular kind of study like an RCT. Should you not just get results just for RCT? So if results come up which are not RCTs, why is that happening?
Yeah, so we were going to talk about it later on. So this is just one, one aspect of development of search strategy. After this, we were to talk about how to limit search terms to specific sections of a scientific paper. So if you limit RCT to titles and abstracts, then you will get studies then you will get more relevant studies, right? But if you just write RCT without indicating title, abstract, PubMed will search for RCTs in the full text of that article. So even if the study is a cross-section study, but they have mentioned RCT in discussion, we'll get that result as well.
I see. Okay, that makes a lot of sense. Thank you. That explains it. Thank you.
So we'll talk about it later on as well when we search PubMed and other databases.
Thank you. That's very useful.
So, just a question. You have briefly touched on it earlier, but then I'm just curious to know. So the systematic review that we are planning to do is quite broader. So not just does it include RCTs, but other studies as well. So does that mean that the systematic review that we are going to do is not of a good quality? And is there, like you had said, separating different, separating results would enhance the quality, but I'm just wondering if that would be eligible for publication in Cochrane or Campbell as such.
So if you're doing a systematic review independently, then you cannot really publish them in Cochrane or Campbell. You can publish them in other peer-reviewed publications. If you wish to publish in Cochrane or Campbell, you have to register the title with them, and you have to use their own software. So Cochrane actually have their own software called RevMan, on which you do all of this addition of studies, in which you rate the studies, assess their risk of bias. You perform the analysis in that particular software called RevMan, and it's a collaborative software. So if you're looking to publish in, looking forward to publication in Cochrane and Campbell, you have to get engaged with them from day one. Send them the title, they will start the process, they will tell you if the title is suitable or not. And then, you will write the protocol for them, they peer review the protocol, and then you start the actual, and then they will look at your team, what kind of team you have. Do you have enough people with systematic review experience? And then they will accept your protocol, and they will invite you to use the RevMan. They will give you a lot of privileges to use their Cochrane database, to use their resources for free. So that's a very different paradigm. We are actually working on non-Cochrane and non-Campbell reviews now. For the Cochrane one, that's a separate paradigm. But coming to your question, that addition of non-randomized control trials. So Cochrane only allows randomized control trials only, but they do mention that that they have found other evidence such as